How long does facelift recovery last?
The facelift has been the gold standard in cosmetic surgery for surgical facial rejuvenation to address sagging cheeks and neck skin. For many people, it's what first comes to mind when thinking of cosmetic surgery, and it is assumed to require a long healing time. For years, facelifts were viewed as an exclusive procedure done by wealthier people who didn't mind a prolonged recovery process until they were ready to reveal their new face to the world. In my practice, I've developed strategies to help my patients have the full range of facelift procedures with minimal risk, minimal downtime, and quicker recovery. I'm Dr. Amiya Prasad. I'm a board-certified facial cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. During my training in facial cosmetic surgery, facelift surgery involved general anesthesia, overnight hospital stay, a large dressing, drains, a lot of swelling, and weeks of not so comfortable recovery. At that time, I began thinking of ways to make facelifts be less difficult for patients to experience with a shorter recovery time without sacrificing the results and the longevity. The first thing that contributes to longer facelift recovery is general anesthesia. For many people who undergo general anesthesia, recovering from the effects of general anesthesia is equal to or worse than recovering from the surgery itself. Side effects from general anesthesia include nausea, vomiting, and lightheadedness. Patients after having general anesthesia are often required to stay at a facility with nursing care overnight and have a large facial bandage with drains. When I perform facelift surgery, I use local anesthesia with light IV or intravenous sedation rather than general anesthesia. The patient is more comfortable with a twilight type of sedation throughout the procedure. We perform surgery within our own office facilities, which are certified by the Joint Commission. After surgery, patients only need to stay in our office for about an hour or two before returning home. A light facial dressing is used without any drains. Basic aftercare involves putting antibiotic ointment where the sutures are placed, and these sutures are removed after 1 week. Patients can return to work in about a week to 2 weeks after surgery. The same standards for surgery ranging from limited mini lifts to extended face and neck lift surgery are applied. The deeper tissue, often referred to as the muscle, is addressed the same way as any facelift procedure performed under general anesthesia. This layer of tissue is called the SMAS, which stands for Superficial Musculoaponeurotic System. I perform the full range of facelifts with this approach, from short scar mini lifts to SMAS flaps and deep plane facelifts. Speaking of deep plane facelifts, it's important not to be overly impressed by doctors claiming to perform deep plane facelift exclusively, to imply that they know techniques that other surgeons don't. In fact, all experienced facelift surgeons are trained in all facelift techniques. Less aggressive facelifts, such as short scar facelift, is not actually a shortcut procedure, but it is appropriate for people who want to lift a sagging jawline but don't have significant laxity of skin and deep tissue under the chin or the neck. A deep plane facelift is actually another procedure performed by experienced facelift surgeons, which involves undermining and tightening the deep tissue layers beneath the skin and the SMAS. The face and neck lift is a procedure typically suited for older patients who have significant laxity in the neck and under the chin, so a longer incision is needed to lift the face and neck at the same time. I regularly perform these more involved face and neck lifting procedures for my patients and still able to get them back to normal life in a week to 2 weeks. Another way I expedite facelift recovery is with advanced wound healing methods. I apply the wound healing material extracellular matrix or acellular matrix, which consistently helps the incisions heal faster and make them virtually imperceptible even after about a month. Recovery time is important, but recovering quickly doesn't matter if you don't like the results. From eyelid surgery to facelifts, I approach all my patients and their procedures with a natural aesthetic. I believe my patients should always look like themselves after any procedure, and in the case of facelifts, a version of themselves which looks 5 to 10 years younger. In my practice, recovery from facelift surgery is optimized by using local anesthesia with sedation, efficient and meticulously performed surgery, and the use of advanced wound healing technology. I hope you found this information helpful. Thank you for your question.